In this video, we will provide an overview of how to use CoverME.gov's Plan Compare tool. To access the tool anonymously, the consumer should go to the main page of CoverME.gov's website, select Get Started, Compare Plans, then Plan Compare. Here, a consumer will be asked to input their zip code and county before shopping, since plan options and prices vary across the state. Additionally, the consumer will be asked to provide some information about themselves and other individuals in their household who need coverage. This information is never stored or sent to insurers. It is only used to help best estimate costs for the individuals looking for coverage. Consumers can optionally enter any expected upcoming procedures or check if any of the additional factors listed apply to them. To add a spouse or dependent, select the relevant button and fill out information for that individual. To receive an accurate eligibility estimate, consumers should be sure to add members of their household if they are included on their taxes, even if they don't need coverage. To do so, they can select Not Seeking Any Coverage. Additionally, consumers, brokers, and main enrollment assisters have access to NAV mode in the top right-hand corner of the Plan Compare tool. This allows you to account for special eligibility cases when determining cost savings, including individuals ineligible for Medicaid due to the 5-year bar or their immigration status, and eligible former foster youth. Consumers can also see if they may qualify for financial assistance by inputting their estimated annual income. Thanks to an expansion of eligibility by the federal government, more Mainers than ever can qualify for financial assistance to lower their premiums. In this scenario, Larry Lobster may be eligible for a tax credit of up to $355 a month to lower his premiums, and may qualify for a cost-sharing reduction that lowers his out-of-pocket costs. Additionally, using the Plan Compare tool, consumers can search for specific providers, hospitals, or prescription drugs to see if the plans they are shopping for cover these. This section is optional. Here we will input a doctor, hospital, and prescription medication to see which plans cover each. On this screen, consumers can see the monthly premium, deductible, and out-of-pocket limits for different plans. The monthly premium is the fee a consumer pays to a health insurance company to receive health insurance. A deductible is the amount a consumer has to spend on covered services before their insurance company pays for most services. It is important to note that monthly premiums do not count towards the annual deductible. Additionally, some services, such as preventative care, may be covered before a consumer meets their deductible. An out-of-pocket limit, or maximum, is the most a consumer has to spend for covered services in a year. After this amount is reached, the insurance company pays 100% for covered services at in-network providers. If a consumer selects Show More for a plan, it will show the cost sharing for that plan based on the type of medical service. A copay is a fixed amount paid for a covered medical service after the deductible is reached. So for this plan, which has an annual deductible of $725, if the consumer spends at least that much on covered medical services during the plan year, then a visit to a specialist that is in-network will cost the copayment of $40. Additionally, some plans may also have a co-insurance for services. This is a percentage of the cost of a covered medical service paid after the deductible is reached. For instance, a co-insurance may be 20%, meaning that the consumer pays 20% of the cost of that service after their deductible has been reached. Further, if a consumer selects View Plan Details, this will pull up a full breakdown of the health plan, including a link to the summary of benefits. This summary of benefits is a short, plain language summary about a health plan's benefits and coverage that each insurance company is required to provide. Additionally, consumers should consider what providers are in each plan's network. A network includes the doctors, providers, and hospitals that a health plan contracts to provide care to its members. Many plans in Maine now use tiered networks, which may be unfamiliar to some consumers. A plan using this kind of network will include the label Tiered Network underneath the plan name. A tiered network places providers into different tiers, and the amount a consumer will pay for services depends on the provider's tier level. Although consumers can see providers in any tier, providers in the preferred tier will be at the lowest cost to the consumer. In addition to tiered networks, plans may also have a regional or national network. A regional network has a network of providers that is limited to Maine or New England, whereas a national network has a network of providers that is not limited to a geographic region. From the main screen, consumers can see what plans are available and see if their doctors, hospitals, and prescriptions are covered in each plan. In this case, Dr. Smith is a Tier 2 provider for this plan, as indicated by a yellow check mark. If the consumer hovers over this, they will see an explanation that Tier 2 providers are not in the insurer's preferred network, meaning they may pay more to visit this provider. Similarly, the hospital that was entered is in a Tier 2 network for some plans and in a Tier 1 network for others. Additionally, the prescription the consumer added is covered by some plans but not others, as indicated by a red exclamation point. Additionally, the Plan Compare tool provides an annual cost estimate based on a good year when very little medical care is needed, a balanced year, and a bad year when major medical care is needed. This estimation is based off a combination of the monthly premiums and out-of-pocket costs combined. For instance, an individual who needs regular treatment for a chronic condition or expects to have a major medical procedure in the coming year may wish to select a plan with higher premiums in exchange for more comprehensive coverage, which could reduce the total amount they spend on healthcare in a year. Of note, the Plan Compare tool defaults to the balanced cost estimate. The consumer can change this to estimate for a good or bad year cost estimate. By selecting the three dots on the right, the plans can also be sorted by premium, plan name, or quality rating. To further sort the plans so you only see one metal level, choose from the left-hand menu. Plans are sorted into metal levels varying from bronze to platinum. Bronze plans typically have low monthly premiums and the highest cost when a consumer needs care. Silver plans typically have moderate monthly premiums and costs when a consumer needs care. However, if an individual is eligible for cost-sharing reductions, then silver plans have lower premiums and lower costs of care. These special savings to lower out-of-pocket costs are only available if the consumer selects a silver plan and is eligible for cost-saving reductions. Gold and platinum plans typically have the highest monthly premiums and the lowest costs for when consumers need care. Beyond the metal level, plans also vary based on if they are an HMO, PPO, or POS plan. An HMO, or Health Maintenance Organization, generally limits coverage to in-network providers and will not cover out-of-network care unless it's an emergency. In a PPO, or Preferred Provider Organization, a consumer will pay less when using providers that are in-network and can see providers that are out-of-network at an additional cost. In a POS, or Point of Service plan, a consumer will pay less when seeing providers that are in-network and will require a referral from a primary care provider to see a specialist. Similar to metal levels, you can sort these plans by their type using the menu on the left-hand side. Additionally, consumers can select up to 3 plans to compare directly by checking the checkbox labeled Compare on each plan tile, then selecting Compare Plans. This allows consumers to compare the plans directly, given each plan's cost sharing. Consumers can select Print Plan Details to either print or save the plan details as a PDF for later reference. They may also want to briefly note the full plan name, health insurance carrier, and metal level so they can easily locate the plan when they are ready to enroll. When a consumer goes to select a plan, a message will pop up letting them know they will need to log into their CoverME.gov account and to write down the plan information before continuing. In addition to using the Plan Compare tool anonymously without logging into a CoverME.gov account, once a consumer has submitted an application, the tool can be accessed while logged into their account. To do so, the consumer will log into their CoverME.gov account and select Shop for Plans. They will then be taken to the Family Information screen to review their demographic information. Next, the consumer will select which family members need coverage and the type of coverage they are looking for, and then select Shop for New Plan. From within the Choose Plan menu, consumers can view different plans and sort them by different attributes, though not the full range of tools available in the Plan Compare tool. To proceed to the Plan Compare tool, the consumer will select Go to Plan Compare. A message will appear letting the consumer know they are leaving CoverME.gov to access the tool. It is important consumers know that they will need to log back into their CoverME.gov account after using Plan Compare from their account if they browse plans for more than 15 minutes. Consumers should write down the name and IDs of any plans they wish to select so they can remember the information when returning to their account if their session times out. Select Are You Sure to proceed to the Plan Compare tool. When accessed from a CoverME.gov account, information from the consumer's account about who is looking for coverage will already be filled in. When selecting a plan during a logged-in session, choosing Select Plan will redirect the consumer back to their CoverME.gov account to complete their enrollment, as long as their session has not timed out. While browsing, to prevent being logged out for security reasons, the consumer can return to their account page every 10 minutes or so to keep their session active. This concludes the walkthrough of the CoverME.gov Plan Compare tool.